Facebook.com/DZRJ810AM or on YouTube, channel DZRJ810AM, Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗏𝗏𝗵𝗏 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗵𝗏. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗵𝗏 on DZRJ 810 AM, Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗵𝗏, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗵𝗏 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗵𝗏. Today, we're going to talk about vaccines, the myths and misconceptions. And we have with us Dr. Timmons Cruz from 𝗏𝗏𝗵𝗏. He is an internist and an infectious disease specialist. And you work in the Health Hub, isn't that right, Dr. Timmons?
Yes.
Dr. Timmons, okay. All right. So,
You call me Doc Tim.
Doc Tim, okay. Doc Tim, thank you for being here today. I think this is a topic that a lot of people are interested in. And of course, you know, like even though we're over the pandemic, this is something that is on people's minds. And I will be asking you a lot of questions today. I know a lot of people have these questions in mind. So, but let's start already with, let's get to it. What are the vaccines that are offered in medical facilities and what are they for?
So we have lots of vaccines here, specifically at the Health Hub. No, so we do have adult vaccines, particularly we have influenza.
Mm-hmm.
We have vaccines for pneumonia.
Mm-hmm.
Your vaccines for your shingles or MMR, measles, mumps, rubella, as well as your varicella. And then we also have for Japanese encephalitis for those that want to travel abroad.
Yes.
We also have typhoid fever, and then most of the recommended vaccines for Filipinos, adult Filipinos, are actually available here at the Health Hub. We also have the more incidental vaccines when you get it when you get exposure from your cats or dogs biting you. We have rabies and tetanus vaccines also.
Yes. Okay. So, doctor, you mentioned a bunch of vaccines, and I may go through that, I may circle back to it in a bit. But I wanted to ask, why do medical personnel or doctors like you believe that vaccines are important in preventing diseases? I mean, why do you espouse?
All right. So, yes. So, vaccination is really more of having yourself exposed to that disease already, and then to prevent it from coming into you. So actually, vaccination works because it boosts the immune system. It boosts the immune system by already making antibodies in advance before you get the disease, so that when it comes, it does not affect you as much as it would if you didn't have that kind of protection. So that's actually one of the myths that I want to
yes, please,
espouse on, is that yes, vaccination helps prevent diseases, but it does not completely you're not totally immune to it. You can still get it, but you already have the protection for it, so that you won't develop the more complications or the more severe kind of disease.
Okay. So let's go through some of that because, I understand a lot of the vaccines you mentioned. We can go, for example, to, you said incidental vaccines like rabies and tetanus.
Yes.
For example, if you get bitten, you put the get bitten by a dog and you're not sure if they were vaccinated, or even if you are sure that they were vaccinated for rabies, why those vaccines work differently from the others? I mean, in the sense that you put it after the fact, that somebody has
after the fact. Yeah.
after the fact. Okay. And tetanus, like if
Yeah.
you
So
if you
so
fall and you scrape your knee, I mean that lives in the soil and like,
yes,
okay, so that's after the fact. Okay.
yes.
How
Yes, after the fact.
Mhm.
Also, rabies particularly is actually very high, very has a very high incidence here in the Philippines. One of the very few countries with still a high rabies
Mhm.
incidence. No, we just give it after the fact, just because the exposure is really more or less limited. No,
Mhm.
if you do, you can really single out which patients who are in need of that vaccine, and that's when you only have the exposure to your cats or dogs. No, uh, when you do get it, you get a total of 3 to 4 vaccinations, depending on the type, as
Mhm.
well as the way it is given to you, whether it's intradermal or intramuscular for you. And the number of injections are really dependent on the protocols that are in place for each hospital.
Okay.
So, as for tetanus, tetanus actually is already part of the children immunization program of the Philippines.
The
No? But
DPT.
then we recommend boosters
Mhm.
every 10 years,
Yes.
or if and when you are exposed to a possible tetanus prone wound.
Okay. Thank you, doctor. I just wanted to talk about that first because they're kind of different, as you mentioned. They're incidental vaccines from the rest, where you don't get them beforehand. It's really
Yes,
attached to the hospital when we have
yes,
a bad wound or a scrape or an
yes.
animal bite. Okay, so let's talk about the other vaccines, doctor. Basically, how do they work? I mean, you already answered that question by saying that you boost the immune system, but it actually helps your immune system fight off the uh, the disease if you catch it.
I think it was.
That you're that you won't get it. It just helps you. Can you talk about let's say antigens, uh,
Mhm.
and how you introduce it into the body? Like, is that small amount dangerous, or what kind of amount you introduce? How does it help boost your immune system?
So, what is really important for vaccines, that uh, there are different types of vaccines. That's for one. We have the live and the not live, the inactive vaccines. No, so the live vaccines work very much so like a natural infection. You
Okay.
know, so much like your measles, mumps, rubella, those are the live vaccines. No, uh, however, the ones that we give are weakened or inactivated already. They
Okay.
will not cause the full-blown disease. No, when it enters your body recognizes that and then produces enough antibodies that will combat that vaccine. No, such that whenever you do get the actual measles, mumps, rubella, or the actual varicella virus in your body, you have already the antibodies that will interact with their antigens, so
Mhm.
that they will be easily neutralized. No, for your other inactive vaccines, that includes your influenza, your pneumococcal vaccines. There are vaccines, but they're only a part of the actual virus itself, or the actual bacteria itself. So being only a part of that agent,
Mm-hmm.
it does not cause a full blown disease, because you're just given a part of it, like
Right.
just the arm of the virus, and then even with just that arm, you can produce antibodies that will react to the whole
Mm-hmm.
virus as a whole. And then, so when if ever you do encounter, your body encounters those antigens again, they already have what we call as memory B cells. The memory B cells recognize, oh, I know this. I've seen this virus before. These are the combatants that we're going to go out,
So
give
if
out, and then that will neutralize the virus.
So if I'm okay, can you please correct me if I'm wrong? I'm just understanding it in a very simple way,
Yes.
as a person and not a medical professional. But it's sort of like, okay, when you give a vaccine, whether
Mm-hmm.
it's live or weekend,
Enough.
or inactive, sorry. And you mentioned things that people know about, like mumps, the rubella, si varicella vaccine. I mean, those are for like
Mm.
measles, mumps, measles, and
Ruben.
chickenpox included there.
Varicella is the chicken.
Varicella, yes, varicella. Okay, that dang chickenpox and varicella. Okay. So we'll talk about shingles later. Okay, so when you inject a vaccine into someone, um, you are introducing. Just correct me if I'm wrong. Some
All right.
what is basically called antigens, and then
Mm-hmm.
the body produces antibodies. Yes.
Yes, exactly. That's
So
good.
it's like you're sort of training the body, like um I guess the way you describe it, like if the arm or and they can combat. So it's like you introduce a little bit because our immune systems are like when they see something, they're like, oh my God, we have to fight this thing, right? So
Yes.
like you're starting to to maybe feel sick, or maybe some people don't actually get really affected by a vaccine, by an injection, but um your body, your antibodies, your immune system starts producing antibodies, and then they're like, okay, we know this enemy, we know this thing that's gonna,
Yes.
if we ever encounter it again, we know how to fight it. So it's like training.
Faster.
Yes, we know how to fight
Yes.
faster. Okay, and that's why you can't really say that you won't get it,
Yes.
but when you, if you do encounter the disease, as you put it, then your body can combat it itself. So you're just boosting the immune
You're
system.
boosting the immune system so that future
Mhm.
when the virus does come to your body, your combatants are all ready to attack.
Like they're ready there, like an army,
Yes.
because you trained them already. Like they had
You've
like,
already
Mhm.
they already know the kalaban, and they can
Yeah,
just mount the response as quick as you can. Sometimes like you said, yun nga, you can still get the virus, the disease, but then because your immune system is primed and ready to react, you get a very mild disease, or sometimes no disease at all, and then you don't even know you've had it, no,
yeah.
because your immune system is already primed and ready to attack.
Okay, that's great. Like sometimes you don't actually feel it. Like if you
Mm.
keep with your vaccines and boosters, maybe
Mm.
feeling a little bit off, or you're like,
Yeah.
it's okay. Like maybe I'm just off today, but you will survive it.
Yes.
Point is,
Usually those reactions are last for 24 to 48 hours after the vaccination. Usually goes away without any further complication.
okay, doctor, we just have to take a short break, but I will ask something about the varicella vaccine
Okay.
when we get back, and it has to do with chickenpox, okay, and shingles. So everybody, stay tuned to Healthline with Makati Med. I'm your host, Nicole Jacinto. We're here with Dr. Timmons Cruz. He works in the Health Hub in Makati Med. He is an internist and an infectious disease specialist. Yes, I'm correct. Okay.
Special.
Okay, so hang
Yes.
in there and just go get coffee or something, or watch the commercials. They're worth it. They're very interesting. Just some information for you. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Gia Season from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We're here with Dr. 𝗏𝗏𝗁𝗏𝗏 of Makati Med. Thank you for being here today, Doctor. Okay, so I'm gonna pick up where we left off, which is we're talking about vaccines, and I did say that I would ask you about the is it varicella or varicella? How do you pronounce it properly?
Varicella.
Varicella. Okay, maybe I'm getting to Italian. Varicella. No, it's varicella.
Varicella.
Yeah,
Well,
varicella.
I've actually heard Italians say varicella. So
Okay, so yes, okay. So for the varicella vaccine, that covers chickenpox.
yes.
And I remember a time when nobody really was getting vaccinated for chickenpox. That was maybe 30 years ago, even 20 years ago. Because what parents would say was, okay, but people were very scared of it in a way. Like they were saying it's bad if you get it when you're older. So
Yes.
whenever someone would get it, like kids, everybody sleep together, all the cousins, all the all the siblings, so that you get it so that you get it already, and then you get it at the same time, and we can take care of you and handle it all at the same
Yes.
time. So when you get certain illnesses or diseases, let's say chickenpox, let's just focus on that. When you're older, is it really more dangerous for the body for you?
Well, that's not really true, no? We only talk about that for varicella. Number one, because varicella has those little scars that will go all over your body. And then if children, when they do have it, they still have lots of time to grow. Their bodies grow fast. They heal almost perfectly.
Okay.
However, if you get it in your more adulthood, let's say 20s, 19s, at those times, those are already, your teenage years. You're very aware of your yeah.
I mean, I remember the pain of chickenpox. When you're younger, it's like, oh, okay, you can
Uh,
forget about it, perhaps. Yes.
the main issue that we have for chickenpox occurring at the older age is the scarring.
Scarring.
But it does not necessarily mean that you are more infectious. You'll be hospitalized. It is quite painful sometimes, or very, very itchy.
Does it
But
depend on the strain? Are some strains stronger than others? Or is
no,
it how your body
really,
reacts?
it's really not based on the strain. It's really just how your body reacts to it. No, some patients develop full blown. Your body has scars and those vesicles, no. But then to answer that question, it's not really about being more complicated. It's really about the scarring that will be more evident if you get it in an older age.
And then I focused on chickenpox because I want to ask you about the vaccine for shingles. Correct me if I'm wrong. What I understand is if you get chickenpox, the virus, which is like also very close to the herpes zoster virus, it lodges in your spine or in your lower spine. Like it stays there, it's inactive. Like it never actually leaves your body. Like you can cure it by expelling it.
Yes.
And when you're older, if you've gotten chickenpox, and I want to ask you what the definition of older is and about shingles. So when you're older, it can be activated again and you can get shingles. So
Yes.
if you can tell us what older is and what maybe triggers it, and because and what shingles is like, so that because people are like, well, I got chickenpox already, and then I'm gonna get shingles.
So that's correct. When you do get your chickenpox in childhood, it stays within you and it resides in a very specific type of cells, particularly the nerve cells. So no, so it could reside in your in any part of the body, but usually it's usually the nerves, and it's usually on the spinal column. No, now when you get older, and by older we mean 50 years old and up,
Okay.
your body gradually weakens, and then there is an off chance that inactive virus in your spinal cord will re-emerge. And when it re-emerges, it causes vesicles, much like the chickenpox, but it's only limited to that specific nerve area.
Okay.
So that's why when we see shingles patient, it's just one side of the chest, and then it has very the typical vesicles. But the main problem with that is it's very painful.
Yes.
You
And
know?
some people don't who have shingles don't know that they have it right away because they're like, what is this? Right? I
Yeah.
mean, it kind of looks more like blisters,
Yes.
sores. So until they go to a doctor or there's someone in the family says, you have shingles, check with
Yes.
then
Yes.
they're like, oh, I've been having this for quite some time.
Yes.
Yeah.
It's actually one of the vaccines that we generally tend to push on because number one, it's very painful. It's not something that you would wish upon your worst enemy. Then it's very painful, and the thing is, it's very preventable. And the fact, and there's the other fact that even if you do present, if you see the vesicles in you, and then you go to your doctor, the medicine only lasts can only affect the medicine, the antiviral that we have to cure or help with the shingles only lasts within 72 hours of the first appearance of
Okay.
the symptoms.
So you
No?
included
So-
it because I'm sorry. Go ahead. I interrupted you.
So if you come later, even if we give you the antiviral, it will not affect the course. No,
Yes.
aside from the cost, it will it is very costly, and then it will not affect the course if it's given at a later time. The thing is, it will only become painful after 5 days.
Okay.
So
there's
we
an
usually get
important
patients that
yeah.
they already come here. It's very painful, and then when we ask when it started, it's more than 5 days. We can't give the medication. It's more of you're gonna have to live with it. It's
Yes.
very painful. That's one. Yeah.
Yes. Like by the time it manifests, it's too late to give the
It's too late to give the antiviral. No,
So that-
unless yun nga, the reason why we also do these talks is that for more patients to be more aware. So if ever you do think that it might be shingles, just a rash appearing on the one side of the body with tingling sensation or electric light sensation in that area, go to your doctor, and then more often the times, if we can give you the antiviral medication before 5 days, you won't have most of the complications.
Thank you, doctor. Because we have been seeing. I mean, I and other people that I talk to have been seeing a push in getting vaccinated for
Yes.
shingles. It's been talked about more now. So I just wanted to clear that up with you and have you clarify that for our audience. Like, why are you pushing the shingles vaccine? Because actually, it's not like you can't. Once you've had it for more than 72 hours,
Yes.
then it doesn't help. You're just gonna have to live with the effects.
Yes.
You get shingles more than once?
Sorry?
Can you get shingles more than once?
Yes, it can recur.
So okay, let's say I got shingles, and then not me. Okay, let's say someone else has had shingles, and then they had to live with it, and then they're well already. Can you vaccinate them at that time?
Yes.
Okay.
So the problem with shingles is one of when you do have shingles, your body also generates antibodies, and that's how the rash disappears. Actually, But the problem with that is that it's not long lasting.
It's too weak. I mean, it doesn't last.
It's too weak. The fact that it even appeared is actually it says something that your immune system is not as primed as it is. No, that's why we still, even after an episode of shingles, we still recommend vaccination after. The soonest you can get it is 2 weeks after the resolution of the rash.
All right, doctor. We just have to take a short break, and when we get back, I am going to ask you some questions that a lot of people have in mind. It's about claims that vaccines, can do more harm than good and all of that. We do have to ask that and we'll clarify it for our audience. So we'll just take a short break, folks, and when we get back, we'll get into some, you know, really.
Controversial.
Yes, okay. Controversial, did you say? Yes, okay.
Yes.
Controversial stuff. Okay.
All
So stay
right.
tuned. Hang in there. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗛𝗶𝘁𝗵𝗹. Available for outpatient care services, our 𝗛𝗶𝘁𝗵𝗹 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗛𝗶𝘁𝗵𝗹 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗛𝗶𝘁𝗵𝗹 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗛𝗶𝘁𝗵𝗹.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Hi, and welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We are with Dr. Timmons Cruz. He practices in Makati Med. You can find him in the Health Hub. And he's actually an internist and an infectious disease specialist. That's why he is here today discussing vaccines and myths and misconceptions. But we're going to go to a part of the topic now that could be controversial, and there are strong feelings either way. Sometimes it polarizes people, but let's get to it. Doctor, what about the claims that vaccines contain harmful ingredients? Can you explain what's really in them, in the vaccines?
Well, the main component of the vaccines are, number one, the immunizing agent itself, the vaccine itself. It could be, again, a part of the virus or the whole virus itself that is already weakened.
Okay.
So that's the main component. Now, the other components that are quote unquote controversial are the what we call as adjuvants. Adjuvants are chemicals that we put in there, and these chemicals are not entirely part of the actual virus itself. No. Now, the point of those adjuvants is to stimulate more your immune system, as well as help your immune system to recognize that part of the virus. No.
Okay.
Some of the more controversial adjuvants that we have include the mercury, the thimerosal, some of those components that are supposedly linked to conditions such as autism. No, that's one of the biggest
and circle back to that
questions about vaccines.
I'd like to circle back to that, doctor, because I'd like to ask you first about something we've all gone through and have been aware of, like very recently. I mean, the pandemic, the COVID-19 pandemic.
Yes.
That was of course that brought up a lot of awareness about vaccines, and there are a lot of questions surrounding it. Can you tell us first what is the difference, because so many people were arguing about it, between and what do you call this, the vaccine, like how they were done when you injected a live, or how do you call it, deactivated,
The inactive.
the inactive, sorry, yes, inactive part, and the mRNA. What is the difference there? Because people are saying, I'll have a genetic, so maybe you can clear that up.
Yeah. So the ones that I mentioned before, the one where you get your antigen, and then the antigen reacts with your antibodies, those are the conventional vaccines. We have the live and then we have the inactivated. No, the third type are those that we have the more recent ones, the mRNA vaccines. The mRNA vaccines, in some sort, also is also an inactivated or incomplete vaccine. Why is that so? So the mRNA is injected into your body, and then it's processed by your cells. It incorporates shortly, just a few times. It has a quite a short half-life, no? But when it incorporates into your cells, it produces proteins that are that your body does not recognize as itself, because it's actually from the virus.
Okay.
No? So when it incorporates, it produces the proteins, and then it dissolves out of your DNA.
Okay.
Now, what you have are the proteins that are foreign, in the sense that they are not yours, but they were produced by your own body.
Okay. So that's why, so they're not yours, but your body produced it because of something that the vaccine introduced.
Yes.
Made your body produce it. Okay.
Yes. And then from those those antigens that your body produce, you now produce your antibodies
So
themselves.
is it really expelled from your DNA?
Yes,
The
it
mRNA?
has a very short. It's actually very volatile. That's why we have very strict conditions on how to transport it. You know, the whole hullabaloo about the cold chain during that time, because it has a very short half life. Once it enters the once it enters body temperature, your body temperature, it
Yes.
quickly degenerates.
Oh, okay. So that's why, like the mRNA vaccines, they had to be refrigerated or at a certain temperature.
Yes.
They had to be. You mentioned it, no? Everyone's like, are these really transported? They have to be refrigerated, or there has to be a certain temperature, and
Yes.
that's because they have a short. You're
Half
saying.
life. Or half life is the time that material gets halved. Ganun. Very short lifespan. Better word would be lifespan for our
Lifespan, yes. So it's kind of like if you have an allergy and you take an antihistamine, some have like they act fast, but they have a shorter
Yes.
effective.
Yes.
So like diphenhydramine has a shorter shelf life than, let's say, I don't know.
Your levocetirizine, mga ganun po.
Okay, great. Okay, because I almost mentioned the brand name. Unless you want to sponsor the show. Okay. Okay. All right. So and you're saying when the mRNA is injected into your body, it starts weakening and dying. Not that,
Yes.
but well,
It actually
lifespan.
is essentially just dissolved.
Dissolved. Okay. So that because our bodies have a certain temperature, right? I mean, we're warm compared to what it needs to keep living.
Yes.
So that's why they take
Yes.
its bag and like,
Mm.
you cannot have this out for more than how many minutes, whatever it is, and bang. Okay. Doctor,
Yes. Mga ganun.
thank you for explaining that. The way you explained it, it's easily understood. And you mentioned also the transport and all of that. And that makes so much more sense that its shelf life or its lifespan, when it enters the body, it dissolves right away because it has to be at a certain temperature and all
Yes.
of that. But okay, let's go to the other questions. We had a problem with dengue with the
Oh, yes.
for dengue. Maybe you can just sort of tell us what happened there. I mean, is it
Mm.
the wait? You're not supposed to get vaccinated with dengue if you've never had dengue. Can you just reiterate that?
Yes.
You never had dengue, okay?
You know, the data that we've gathered here in the Philippines during that whole event was that patients who have had previous who have not yet had previous dengue vaccines have not had previous infections were at risk of developing severe complications. That's the number one the one of the conclusions that we certainly submitted. It's more of a report from the vaccine manufacturers. But then we had that data. It's a very small data, quite although very significant for us Filipinos. No.
Yes, because
Now, when we pulled all those data together with data from other countries, actually it looked as if it was insignificant for us. That's why during that time they still gave out the vaccines, and then unfortunately, what we call siguro, I can say it now, no, but during that time it was really sensationalized. No, there are it is normal that patients do have side effects from your vaccines, but then during that time, from the side of us doctors, it felt that it was too sensationalized, and that even diseases that were not really dengue were attributed to the dengue because they had the vaccine. So it was more of a very it was what we want to do in the medical community, because is when we give out certain medications, we try to avoid introducing other factors that would influence you to increase your reporting. No, number one, because of that's we call the placebo effect. Nakita niya na nagkaroon siya, may sakit na rin ako. So in that chain of disastrous chain, nagkaroon na increased reporting. Sometimes hindi naman talaga dengue, pero they reported that dengue, and it really blew out of proportion. So that's one for us. But now when we look back to the data, just the data from now, we see that it was really not as significant as it was brought out in the media at that time. No, yeah. Actually, that whole process of the 𝗛𝗵𝗁𝗶 case actually had significant impacts in our current vaccination status here in the Philippines. Right now, although other countries have used the same vaccine and have been very effective to them, sa atin hindi na siya no market, no? That's one. And then because of the whole fiasco, other dengue vaccine manufacturers are also kumbaga meron silang konting takot na baka hindi rin nila ma-market ulit dito sa Philippines. So, and that severely affects everyone else who has dengue now. I think that's the bigger problem.
You're saying I mean, if I'm correct, you're saying like that brand that came in, they were the first ones in.
Yes.
Then the whole thing happened, and sadly, a lot of people got sick or perished. But when you look at the data now, it wasn't all due to dengue.
Yes.
Now, if you are encouraging getting vaccinated for dengue, it's not on the market here because the other manufacturers or brands are scared to come in because we just have this. Sorry, we don't want to get the dengue vaccines because of what happened, because of everything that transpired. Hi, doctor. Hello? Okay, folks, let's just wait for doctor to come back online. So anyway, such an interesting conversation with Dr. Cruz, Dr. Timmons Cruz, and I know a lot of you have at least heard of these at least heard of what we're discussing on the show. And we're just going to take a short break. We'll be right back as we get Dr. Simmons back online. Stay tuned.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Hi, folks, we're back. Healthline with 𝗏𝗏𝗏𝗏 is back, and we've got Doc Tim back with us. Okay, so we were just discussing vaccine, other factors, because we are talking about vaccines, myths and misconceptions, and a lot of people do still have questions. Doctor, you mentioned earlier that there are some other ingredients in vaccines that,
Yes.
and I mean, not just the agent itself or the antigen, but they're there, in the vaccines. And you did mention autism. I wanted to ask you about that because there are a lot of people who believe that in the past and until now, they don't want to get their kids vaccinated because it causes autism in children, and this cannot be, it can't be. I mean, they can't reverse it. Once you're autistic, you're autistic. What do you have to say about that?
Yeah. So actually, the claim that vaccines cause autism was actually perpetrated by an American physician at that time. No.
Hmm?
Long story short, he was actually discredited for all those claims. He botched up his claims and the numbers of. He was actually one of the vaccine manufacturers, no. So he botched up some of. There was a fact-finding commission done for that, and then during that time, they really found that there was no evident link to that, to autism and vaccines. No, however, when it already got out,
Yeah.
there was actually no stopping it. After a while, he even retracted his own statements because he was actually being, quote unquote pressured by the organizations into but then when we really look at the data, it is simply not correlational, no. I mean, it's not causative, that's number one. Correlational, not even, no. So you sabihin, vaccines don't cause autism, and vaccines may also not be associated with autism, no. So ako, it's very hard when patients read up online, no. That's one of the bane of our society now. When you read up online, you type do vaccines cause autism, meron kang sobrang daming mababasa, no? And some of them have believable, no. So ako, ang advice ko sa mga pasyente natin who are very concerned about autism and vaccinations, I guess ang mas maganda talagang tanong is your doctor, no? You have a dialogue between your doctor. Doc, sabi ng Google, ito yung nakita ko, sabi ng isang patient, nakita ko ganito. And then we will discuss it, no? Mahirap din maggawa ng generalization na lahat talaga yun hindi totoo, no? What we can always say as medical professionals is we've seen the evidence, no? Hindi naman namin ini-invalidate na nagkaroon ng ganitong symptom yung isang pasyente o isang kakilala nyo. But if we look at the whole spectrum, no? Wala talagang hindi namin completely masay na it can cause autism, no?
So, doctor, you mentioned,
Especially in the US, sobrang lakas ngayon ng anti-vaccine
yeah, the feeling, sentiment, yes. And doctor, you said the doctor who made the claim was also a manufacturer.
Yes, it's actually one of the is one of the quote unquote greats of of vaccine development, no?
May I know?
So there's a whole story about why he did that, no? But I don't want to go into it.
So maybe we can talk about it like offline somewhere, just for my
Yeah.
own edification. Okay, so but the investigation, would you know who did the investigation? Was it all doctors, a study, or just the FDA?
So the investigation was done at
Yeah, okay, never mind. Okay,
no,
so
the US FDA did
Hmm?
the US FDA did the study, which was also supported by the World Health Organization because it was a really major claim, and everyone else at that time had had doubts, no, and being presented by a respected physician and vaccine developer, it was really big.
Of course, yes, he had the credibility.
No?
Okay, so doctor, since
Yes.
we're on that topic, I mean, some people believe it's better to just get the illness and have your body get, I guess, have your immune system fight an illness or disease naturally. Is that better in some cases? I mean, is it actually better in some cases? Because a lot of people are not vaccinated for a
Mhm.
number of things. I know someone who isn't even vaccinated for COVID.
Mm.
Thank God the person survived. But I mean, is that,
Yeah.
would that be a better thing? Or like, what's the difference? Because some people be like, ah, you know.
I wouldn't say
Mhm.
it's totally not better. That's why. No, natural immunity, if you are able to mount your adequate response, that's well and good for you, no? Now, the reason why we really advocate vaccination is that what we call is herd immunity. For those patients who are not able to get the vaccines because of certain impediments, their immune system is too weak, they have cancer, they're undergoing treatments, they have allergic reactions, no? The point of the vaccination is for you to protect those patients, no? Number one, this is the concept of what we call as the herd immunity, no? In a bubble of 100 people, five patients cannot get the vaccines, no? Now, in order for those patients to not even get to not get the virus, you have to vaccinate at least 80%.
Okay. Yes.
In that sense, the virus cannot jump from an infected individual onto them because, kumbaga, wala na siyang tatalunan, no?
Yes.
That's the concept of herd immunity. Now, if you lessen that herd immunity, you lessen the vaccination of even healthy individuals, no? They have to be vaccinated. If you lessen that, there's a chance that you can get it, natural infection, yes, and then you survive from it. But then you go home to your lola and
Yes.
then your Lola was not vaccinated.
And you make
Your
some.
Lola cannot mount a respectable immune response, and that's when the deaths roll in.
Yeah.
No, patients who are not able to defend themselves because of their own immunity are more likely to get that virus because someone else was not vaccinated.
Yes. Someone else was not vaccinated.
So actually, vaccination is protection for you as well as the community.
Yes. So it is an idea of the community. Although a lot of people, of course, are like, well, why do I have to? The ones who are scared, or I mean, for example, we have to go to the COVID vaccine because we all experienced it. The COVID vaccines.
Yes.
Some people believe that certain brands made them sick, or like now they have side effects. We're still talking about like how they can be harmful. They some and they it really has manifested. I don't know. I'm sure studies are being done. Of course, we all had to survive COVID.
Yes.
Right? I mean, we all had to do it, but many people were very doubtful and worried because the vaccine was made so fast,
Yes.
which of course we also needed it so fast. And then there were different brands, and like there are claims from people, like some people who got the shot from this brand or the one shot brand now have illnesses, and it just manifested, and it's from younger people up to older people. Like they have some breathing problems, or their blood pressure tends to spike, especially if they've gotten all these boosters, and it's associated with certain brands. I don't want to get into it and mention it, but yeah, there are a lot of people who are looking into that right now. What can you say about that?
Yeah, we are currently studying some of those long-lasting effects, no? But one study that has been more kumbaga more convincing has gotten quite reputation is that some of these conditions that are more prominently reported are actually caused by the COVID vaccines, by the COVID infection itself.
Okay.
This is what we call as the long COVID, no? So
Okay.
it's not necessarily the vaccine, no? But then long COVID is actually a very recognized phenomenon, no? Yeah, you've had the COVID vaccination, but then you could have still, I mean, the number of COVID infection at that time was still very high, no? Even if you had your vaccine, you could have gotten it, but then because of the vaccine, you've protected yourself.
Mhm.
And then what you have had in the process is what we call as the long COVID, no? Currently we're still studying about long COVID. It still has effects, and that's very true, no? And however, we're also not discounting that it could still be vaccine related. That's why we're still going into that study nonetheless, no? Talagang inaaral pa rin natin. We also want to do this so that we can remove some of the doubts that some of our patients have experienced. So all over the world, that's not just in the Philippines.
Yes.
All over the world, they are still asking, and that's the beauty of science for me. You can always ask questions, and hopefully the scientists will find the answers din naman.
And doctor, when
Yeah.
it comes to long
Did I
COVID,
answer the questions?
clear up something for me. What exactly is long COVID? Because is it like, okay, let's say you've been vaccinated and then you got COVID and you did feel the effects. And then, after a certain number of days, you did your antigen test and okay, it says that you don't have it anymore. You don't test positive anymore, but your
Yes.
body still has, it's still weak from that. It's parang something like I don't feel like I've recovered fast, or could it be like you feel you've recovered and then it hits you again in a few months, that kind of same weakness. Um, what exactly? I guess because some people feel they have long COVID, but what is the definition?
Long COVID, we have different names for it. The long COVID, post-COVID syndrome. It all refers to the weakening of the immune system, basically after a COVID infection, after a positive RT-PCR. Actually, yun yung main requirement ng any positive RT-PCR, and then you experience some of these symptoms. These symptoms include your what we call as tired, yung easy fatigability. There's what we call as the commonly known as parang perpetuated as fog brain, as in you have
Yeah.
moments of forgetfulness. Sometimes people report of dizziness, and sometimes they have changes of the taste or the smell that was very prominent during that time. So those are the more common symptoms, no? Where more common symptoms of long COVID that can appear even after 6 months from the time of your infection. So some of these that are actually associated with vaccines were deemed to be actually from long COVID. However, we, as I said, we are still studying whether some of these vaccines are really causing some of these complaints. No?
Or
Again,
the you're studying both the vaccines and the
long
effects
COVID.
of the vaccines and also the effect of long COVID or COVID
Yes.
itself. Because I mean, you did say at the time that if you get it, it will cause your blood pressure to go up, your lungs, all of these things. So,
Yes.
doctor, one last question around that. How are vaccines tested and how do you make sure they're safe? I mean, you can just give us a brief overview of that if you'd like.
So we have 4 phases of vaccine development. First phase, you give it to patients who are a very small number of patients, and then phase 2, give it to more patients, and then phase 3, thousands of patients. Parang ganun yung usual na And then the usual is that you go through phase 1, phase 2, phase 3. Phase 4 is what we call as the post-marketing surveillance. You give out the vaccine and then we look at the real world setting. Ganun nangyari, no?
So,
So ano nangyari, it's also a common myth that COVID was parang masyadong minadali, no?
yeah.
The way they cut their corners, that initially we wait for vaccine phase 1 to do, and then after the completion of phase 1 we get to phase 2. Completion of phase 2 we get to phase 3. For the development of COVID vaccines, the reason why they were able to put it out was so fast was that during when they started the phase 1, midway phase 1 they started the phase 2.
Okay.
They got a special permission to do that because it was a pandemic, no? And middle of phase 2 we already had the phase 3. By the time phase 2 was finished, phase 2 was started midway, phase 1 was already done.
Okay.
And then if there were problems with phase 1, they'd stop the phase 2.
All right. That's
Parang ganun po siya, parang staggered po siya, no? Actually, konti lang yung lumabas na vaccines natin, no? Sobrang dami talaga nagawang vaccines, tinry na vaccines, pero most of them failed.
Okay.
So these vaccines that we have now are the ones that actually passed phase 1, phase 2, and phase 3 studies, no? So we were able to do thousands before giving it to millions of patients, kumbaga, no? So yun lang yung magandang naging effect nun. We have a thing na, ay, lahat din naman in-approve and all, ganito, ganyan. Pero when you look at the data, sobrang dami pong na-fail na vaccines, even before we get the most common, the US vaccines or the Chinese vaccines, marami pa rin po talaga nag-fail and na-reject because they failed phase 1, failed phase 2, or failed phase 3. Nangyari po talaga yan.
Actually, yes, there's not that.
That's also one myth that I want to debunk. Hindi naman minadali.
Yeah.
They still had to go through the process. It's more of cutting corners lang naman.
Okay. And the volunteers were like, okay, I'll do it.
Yeah, there were lots of volunteers then.
We have to thank them also,
Yes,
for that. The ones who risk their lives just to,
to get that.
yes, to get it out to thousands and then millions. So, Doctor, we're running out of time for this show only. You can tune in again next week. But Doc Tim, it's been great, talking to you. You explained a lot of things about vaccines, testing, and all of that. And now we're in the phase 4 because we're monitoring it, diba? But
Yes, exactly.
you explained a lot of things that that people don't really get to hear. So I hope this reaches a lot of people. So of course there will be some people who don't like vaccines. I mean, I myself am not really. I'm in the middle. That doesn't matter. It's actually what each individual audience member thinks and feels. But as a doctor, if someone is hesitant to get a vaccine or scared, or they just are unsure, they're wary, what would you like to tell them, and is there anything else you'd like to say, as a message you'd like to leave for everyone who's watching and who will
Yeah.
watch?
So, siguro as a message for those who are having second doubts, and that's normal. Actually, having second doubts with any medical opinion, anything that you put into your body, that's all right. Question it, no? But then you should also we look at the data, the bigger picture, no? Some patients get their data from testimonials and anecdotes. Some, when you hear those, they are very scary, what I advise to our viewers is that if you have doubts, bring your doubts to your doctor. Definitely, he can answer most, if not all, of those doubts, at least in the best way he can, so he or she can convince you to get the vaccination. If not, we'll do it some other time. Sometimes hindi rin naman talaga siya sa akin one time, okay na. Hindi na naman. It's really a conversation. We don't have the monopoly of the information. Then baka meron kami hindi nakita na nakita mo. We can talk it over, tignan natin kung if it really works out, and then maybe ako pa ma-convert mo, no? But again, syempre, it's more of a,
like, I don't want to get the flu vaccine this year because and you may okay, don't get it this year.
we can talk about it. We can talk about it, definitely.
Okay.
And that's the beauty of medical of seeking medical opinion with your experts naman. Hindi rin sila ganun kasarado. Meron silang sarili nilang bias, but then when you talk to them, and then they see that they see that you actually have real concerns and not just testimonials. They'll try to address that and help, and they'll convince you to hopefully look at the data. No, that's still the most we can do. We can give you the data. However you process the data, that will be up to you. And hopefully, to the betterment of the community, you get vaccinated.
Thank you, Doctor. Okay, is there anyone you'd like to say hi to before we go?
Well, hi to all my patients. Get your flu vaccination. What I always recommend to my patients, that at least for adult patients, I usually deal with adult patients.
Mm-hmm.
You get your flu vaccine, you get your pneumonia vaccine, you get your shingles vaccine.
Okay.
Other vaccines, pag-usapan pa natin. Pero definitely, tatlong yon, go get it. Especially if you're 50 years old and up. Because it will really help you.
Thank you, Doctor. Thank you for being on the show. Folks, tune in again next week. See how these exciting conversations that we have with the doctors from Makati Med. And today was really special. It's a hot topic, I'm sure. And there are many things to think about, many things learned. Thank you for tuning into the show. Thank you for being on the show, Doc Tim. We'll see you next week on Healthline with Makati Med.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.